I'm called Dr. Barnabas Atwiine. I'm a childhood cancer and blood specialist. I work with Mbara Regional Hospital and Mbara University of Science and Technology in Western Uganda. Most of my work involves treating children with blood diseases and cancer, and teaching students, both masters and undergraduate, regarding childhood cancer and blood diseases. And also doing activities both in the community and in different places regarding increasing awareness regarding children with cancer and blood diseases. Yeah, childhood cancer is becoming a major problem, really, and being recognized gradually, especially globally, but also in Uganda. We estimate that about 3,000 children develop cancer every year in Uganda. Unfortunately, only about 1,000 get diagnosed in the 4 cancer centers in Uganda. That means that 1 out of every 3 children get diagnosed. The other 2 out of 3 children die without knowing that they have cancer, which is extremely a sad statistic. And so, this is really a major problem in most of the developing world, where actually 85% of all the children with cancer worldwide live, because we estimate that about 400,000 children with cancer develop cancer every year all over the world, and most of them, over close to 90% of them, actually live in the low and middle income countries, where capacities to diagnose and to treat and to report and register about them are really seriously inadequate. And so most children die of cancer without actually anyone knowing that they actually had cancer in the first place. And that's a very, very difficult, very, very sad thing. And so many children die with the pain of cancer. And that's why I think it's very important that we amplify the voices regarding cancer management. Yes, so now childhood cancer is very different from adult cancer. Whereas adult cancer can be screened for, some adult cancers can be screened for and actually prevented. That's not possible in childhood cancer. The only thing you can do about childhood cancer to improve the outcomes is actually diagnosing them early and treating them early. Because when cancer is actually identified in children early, the chances of its treatment and cure are extremely, extremely high. And most children actually who come with early disease or early stage disease actually do respond to treatment very well and do cure. Most children who come with advanced disease, it's extremely difficult for us to cure them in our setting without the kind of resources and that we have here. And so it's extremely important that children are identified in time and referred for diagnosis and treatment so as to raise their chances of cure. Unfortunately, that doesn't happen a lot, and about 75% of the children that receive here actually already have advanced disease. And that makes it extremely difficult to treat them and to cure them. And unfortunately, these children, when they come here, they're not coming from their homes. They're actually coming from the health system. They've already been in the health system for quite some time, which health system has unfortunately not been able to identify them in time and refer them in time. And so those children are usually treated for so many things before anyone thinks of cancer. And so I think there's really need for increased awareness and technical capacity among the health workers in the primary health centers, especially to identify the children in time and refer them in time so they can get their treatment in time. Treatment abandonment is when a child is unable to complete their prescribed treatment, and in such a way that has a very serious impact on the outcomes of the child. The child's cancer, and that's it's actually the most important cause of treatment failure among children in our setting, and this is really caused by so many problems. Sometime back, we actually surveyed this very question, and we found that most families fail to continue bring their children for treatment, really because of financial difficulties. As you know, that cancer is really a difficult disease to diagnose, to treat, and takes a long time for most of the cancers to treat. And it's very extremely difficult and extremely expensive for families of our patients, of our people in the communities to continue coming for treatment. It's extremely difficult. So the commonest problem really is financial difficulties, and so money to buy some drugs, money for upkeep, for food, for transport, money to keep the other children who stay at home, money to do so many things, to run some tests, to buy so many necessities that are very, very important for cancer treatment. It's a very, very serious problem. The other problem is that people have so many other things to take care of. They have so many other children to take care of. There's so many businesses. They have work. So they have so many things really, really to take care of. And sometimes they have divided themselves between taking care of the child and taking care of the rest of the family, or taking care of so many other things that are very important for families to take care of. And that becomes extremely, extremely difficult for them to continue their care. I think the other reason they said they failed to come was because some people believe that cancer is not curable. Others believe that they're better off taking their children to alternative care, including spiritual care and including things to do with herbal medicine and things like that. But also the fact that there are very few cancer centers in Uganda. The whole of Uganda now has effectively 3 cancer centers, and that's extremely, those are very, very few compared to the number of children that need to be identified and treated. For example, Mbara Regional Referral Hospital, where I work here, is the only regional referral hospital in Uganda with a cancer center. So if you put other cancer centers in other regional referral hospitals, you perhaps will get the same amount of children. And it means that so many similar children who come to us here with cancer also go to other regional referral hospitals in Uganda, but they are not identified and they are treated for so many other things. And so really on top of the family and social problems that bring about treatment abandonment, the fact that there are very few cancer centers and sparsed in between in Uganda makes it extremely difficult for these children to be identified, to be treated, and receive care through their treatment journey. Yeah, cancer is an extremely complex disease, and treating it is not a one-time off. It usually takes a lot of time trying to establish a diagnosis, trying to be sure that's the diagnosis, starting the treatment, and most of the treatments really are numerous cycles over several months and sometimes years. There are some cancers that take more than 2-3 years to treat. And that takes a lot of toll on the families and the caregivers and the children themselves. And so usually it's very, very, very important to involve the family to make decisions, because usually a child with cancer is going to cause a lot of disruption in the normal life, to the life of the family. Most of the time, either the father or the mother or another important guardian is going to leave the rest of the children at home and come and take care of this sick child for usually long periods of time. And that has serious, serious implications on the lives of the rest of the family that are left at home. And so it's very, very important, and that's what we usually do here, that when we're making plans, treatment plans for these children, we involve the families. We tell them ahead of time how long it's going to take, and we tell them ahead of time how often they have to come to hospital. We tell them about the time, how many places they have to go to seek different treatment and different modalities of treatment. For example, we tell them ahead of time that they may need to travel to Mulago for radiotherapy, or to go to other different places for different modalities of treatment. It's extremely important so that the families plan ahead of time who takes care of the other children that stay at home, who takes of, as people need to arrange with their employers and on where and how to get prolonged leaves. People need to work around their businesses, their farms, and so many things. And so it's very, very important that they're involved, and sometimes even give them the real protocol that we use to treat them, writing in the dates so that they know when they're going to keep going and coming. And all this is important so they plan ahead of time. And nothing comes as a surprise. So they plan for all these eventualities and for all these movements up and down in time so they can adhere to their treatment. Yeah, there's a lot of iniquities, yes. Like I'd said before, the fact that there are only 3 effective cancer treatment centers in Uganda means that so many children have no access to cancer treatment and cancer diagnosis and treatment. And all these centers are really in the political south. So here in Barara and in Kampala, there's a center in Gulu, but honestly, it is very limited in scope. And so most of the children in northern Uganda, eastern Uganda, have to travel all the way to Kampala to access care. And that's extremely difficult. And also children, when, there's so many things that are the families, part of the treatment that the families have to mobilize for. There's some investigations that the hospital does not provide, for example, and families have to raise money for them. There's so many treatments, so many drugs that the hospital cannot provide, and the families have to raise money for them. And certainly when the family is already living in poverty and in depravity and lack, they'll be unable to provide those specialized treatment. And so it becomes very, very difficult for them. When we refer children to Mulago for radiotherapy, it's extremely difficult for families to travel to Mulago, stay in Mulago, and stay in Kampala, and raise the money and the fees for radiotherapy at the Uganda Cancer Institute. Yeah, I think reducing the burden of cancer in children is about early diagnosis and treatment, because unfortunately, contrary to what happens in adults, there's no screening, there's no prevention of cancer in children. So the only answer to this is increasing early diagnosis and treatment. And so we need facilities for early diagnosis and treatment. And the first and the most important thing is specialists. I think usually you need specialists who run programs and lead programs or cancer programs that are able to identify children with cancer. We need more cancer centers. These specialists can be sent to the different referral hospitals, and so they can start programs in different different regional referral hospitals. We also need resources, really. The Uganda Cancer Institute has been kind enough to provide us with medicines, but the scope needs to increase, and the regularity of the supplies needs to be stabilized, so that there are no periods when families have to buy medicines for their children. Because a lot of times, some families which cannot buy medicines for their children will be off treatment for prolonged periods of time, simply because the families cannot afford to buy the drugs. I think the other thing is about diagnosis. I think making a diagnosis of cancer is a very difficult process, really. And it's only done by a few people who are really trained in a specialized way. But also it takes a lot of money and a lot of resources and a lot of equipment. So it's very, very important that all these are really, really taken care of. And generally, there needs to be like a really national pediatric cancer control plan, so that people are not just doing things in different places in different ways, but everyone is doing the same thing, a standard thing, in a way that is validated, in a way that is understood, so that all the children are getting the same kind of treatment that is known to be efficacious and supportive. And also there's need for increased awareness among health professionals. running the primary health facilities, because ultimately these patients, when they fall sick, they go to health facilities, but unfortunately they find health workers who have not been initiated regarding presentation of childhood cancer. And so unfortunately these children are treated for so many other conditions until that they worsen and they're referred here as other diseases, or they die in the process, of course. And the problem with childhood cancers that is usually fast-growing cancers. Most of them are fast-growing cancers, so they'll not give you a lot of time for you to, find and take time to understand what is wrong with the child. Unfortunately, when children are not treated in time, they'll either progress, their cancer will either progress to advanced diseases, or they'll actually die in the process, which is very sad. And regarding preventing treatment abandonment, I mean, there's so many ways we can do it, but generally, I think we need to support families of children undergoing cancer treatment. Cancer treatment is extremely expensive and extremely difficult, and we cannot leave it to the families of children to buy the medicine themselves, to transport themselves to and from hospital, to take care of their meals and their necessities and everything they need to stay in hospital. I think there needs to be different programs and different interventions that are aimed at providing out-of-pocket costs for families of children with cancer. Where this has been done, this has actually reduced the cancer treatment abandonment tremendously, and I think families of children with cancer need support to go through this journey. Palliative care is really part and parcel of the management of conditions like cancer, because palliative care, the understanding of palliative care currently is really response to health-related pain and suffering. And this pain can be physical, can be emotional, can be spiritual, can be psychological, and can be in so many domains. And so palliative care kind of tries to approach the care of children with pain and other chronic illnesses from a holistic point of view, where not only the medical needs of the child are taken care of, but also the other needs, the social, the spiritual, the psychological, but also the needs of the families and everybody affected by this illness. Now, this is important in every illness, but mainly important in illnesses that tend to be chronic or long-standing, but also tend to have far-reaching consequences on the lives of the children in terms of the length of their time, but also the quality of their lives. And so it's just part and parcel of the treatment. And it's not very good that we only attend to their physical pain. It's not good that we attend to only their medical needs, but also all the needs of the child, and understanding that the seeking care for childhood cancer is extremely difficult. And not just leaving it to only the families, also not leaving it only the medical workers, but all the other people that actually can offer different specialties. So it's extremely important, and where it has been done, it's actually shown that it improves the quality of lives of children and families of children, quality of life of children and their families. And so it's extremely, extremely important. But also the other thing is, it also makes the whole cancer treatment journey more bearable. When the pain is taken care of, I think a lot of times people think children don't go through pain or don't understand pain or don't feel pain, but actually do, and they actually suffer from it so much. And so their pain, both physical and spiritual and mental and psychological, needs to be taken care of so that the experience of seeking care does not become such a terrifying experience, but becomes such an experience that is bearable, and that people feel that someone is holding their hand and walking with them through this journey. So it's been a very wonderful opportunity to have to talk about this problem that is dear to my heart, that I deal with every day and live with every day. And I'm very glad that so many other people are coming to support and to help, including Amplifying Pain Management in Uganda by Palliative Care Association of Uganda, a very, very, very important in increasing, especially awareness about childhood cancer, but also about the availability of its treatment. A lot of people, when they hear that their children have cancer, they imagine that that is usually the end of their lives, that they think that there's nothing that can be done. And that's not the case. I think our philosophy here is that no matter the circumstances, no matter the resources, something can be done about every child with cancer. And so we aimed at curing children with cancer, and those that we cannot cure, we care for them. And those that we care for, we also provide them with comfort. So that whatever amount of time, whatever we're able to do, these children live a very comfortable life, and whatever amount of time they have to live, they live when they have dignity and when they have comfort, and that when they rest when they have been taken care of. Thank you very much. It's been a very wonderful opportunity, and I'd just like to call upon everyone to please support the causes of the children with cancer. Any child, anywhere, at any age and at any time can develop cancer, and people who develop cancer is not their fault, it's not their problem. It's just that it's just bad luck, bad accident that has happened to them. And so these children need, and their families need, support of every form and in every way. And I appreciate your kindness towards them. Thank you very much.